Okay, we have donned the PPE, the 2 sets of gloves, have face shield, the goggles and glasses, a mask, and then we have this drape or apron. We have everything set up already. All forms have been filled out, verified. We've gone ahead and made sure that the viral transport medium and everything needs to be labeled with the patient's information or the passenger's information. We take the applicator and we introduce ourselves. My name is David. I'm at Airport Medical. We're going to be doing a nasopharyngeal specimen collection. We're going to have you just kind of look up towards the ceiling just slightly, okay, so that we can get your head tilted just a little bit. And when we introduce the swab in, it may cause some slight irritation. You may feel like you have to cough, sneeze, or your eyes might get watery. As we put this in, try not to move your head. Keep your head as still as possible. So I stand from the side. Go ahead and straight shot back. Hit resistance. We do this for a minimum 10 seconds. Withdraw the applicator out. Now, this is where our patient would be masked, and it would just be covering the mouth area. We come back to place our applicator swab into the viral medium. We'll have to open up the cap, place it inside, close the cap, and that's where we have to make sure that there's no leaks and liquid. And we've already prepared the specimen bag where we folded the sleeve, or we folded the package over itself so that anything on this side of this is contaminated, and we can later on use the inner sleeve to fold it over. So we collected the sample. At this point, it would be helpful if we had someone that we could give these consent forms already, or we would have distributed the consent form, the patient information form. So on the patient information form, we'll tell the patient that the results will be given to you. You have a number that you can call the Department of Health. It's on this sheet. We want you to make sure you monitor yourself for additional signs and symptoms. At this time, you are on a quarantine, so do not leave the home. If you do have people that come around or visitors, to make sure everybody is wearing face masks and so forth. Now, as the removal, this is where we don't have a self-dispensing hand sanitizer. We would clean these first set of gloves. Go ahead and wash with hand sanitizer. And basically we would pull this forward. And we start rolling up. Our PPE. And dumping it into the trash. We would then clean our hands with the sanitizer again. Reaching from the back and placing the into the dirty area so it can be cleaned. Go ahead and wash our hands again. This, removing from the side, staying away, keeping that in the dirty. And then wash our hands again, and then finally we would remove the mask and then place that into the trash or into our biohazard bag. We would clean again. put on a new mask, and we can now grab and seal this bag up, and then we would place it into the secondary bag. And remember that we placed the forms all into that other bag. This would then just get placed into a cooler. And then we can go ahead and clean again. Take off our gloves. And then wash with soap and water. Now the specimen itself can be left in the cooler for a few hours. If it isn't, then we have 4 hours to get this specimen to the lab. Because for every minute that, or for every hour that it stays unrefrigerated, the viral load or the count diminishes or declines. So there's less of the virus for them to test. Okay, let's move back on. So we would don another pair of gloves during this time. And since this is in the clean area, we'd spray down our mask, spray down our goggles, take these wipes, wipe down the face shield, wipe down the glasses, and then we can place that as we moved all of these out of the way. We'd place this back in the clean, wipe this down again, and then place this down in the clean and to let it dry area. And so everything now is gone, and basically as this dries off, then now this can be hung, and we can just fold all of this back up into itself and put it into our biohazard bag.
Any scale.